Hello everyone, in this video I'll be explaining on the sterilization, disinfection, antimicrobial agents and universal precautions. Coming first, the universal precautions. The universal precautions refers to the practice in medicine of avoiding contact with patients' bodily fluids by means of the wearing of non-porous articles such as medical gloves, goggles, face shields, or face masks. These universal precautions are control guidelines to protect workers from exposure to diseases spread by blood or other body fluids from the patient. First is hand hygiene before and after any direct patient contact and between patients whether or not gloves are worn. Immediately after gloves are removed and then before handling an invasive device and also after touching blood, body fluids, secretion, excretion, non-intact skin and contaminated items even if gloves are worn. During patient care when moving from a contaminated to a clean body side of the patient after contact with inanimate objects in the immediate vicinity of the patient. And next is patient care equipment. Handle equipment soiled with blood, body fluids, secretions, and excretions in a manner that prevents skin and mucous membrane exposure. And then contamination of clothing and transfer of pathogens to other patients or the environment. Clean, disinfect, and reprocess reusable equipment appropriately before use with another patient. Next is personal protective equipment. Assess the risk of exposure to body surface or substances or contaminated surfaces before any healthcare activity and then select PPE based on the assessment of risks, clean gloves, clean fluid resistant gown and masks and eye protection or face shield. Next is prevention of needle stick or injuries from other sharp instruments, handling needles, scalpels, and other sharp instruments or devices with care, cleaning used instrument, disposing of used needles or other sharp instruments. Next is respiratory hygiene and cough ethics. Persons with respiratory symptoms should apply source control measures, cover their nose and mouth with coughing or sneezing with tissues or masks, dispose of used tissues and masks, and perform hand hygiene after contact with respiratory secretions. Healthcare facilities should place acute febrile respiratory symptomatic patients at least 1 meter 3 feet away from other in common waiting room. If possible, post visual alerts at the entrance to healthcare facilities, instructing persons with respiratory symptoms to practice respiratory hygiene or cough ethics. Next is environmental cleaning. Use adequate procedure for the routine cleaning and disinfection of environmental and other frequently touched surfaces. Next is linen. Handle, transport, and process used linen in a manner which prevents skin and mucous membrane exposure and contamination of clothing. Avoid transfer of pathogens to other patients or and to the environment. Next is waste disposal. Ensure safe waste management. Treat waste contaminated with body fluids, blood, secretions, and excretion as clinical waste in accordance with local regulations. Human tissues and laboratory waste that is directly associated with the specimen processing should also be treated as clinical waste. Discard single-use items properly. Next, coming to the antimicrobial agents. The interpretation here, the results are interpreted as susceptible, intermediate susceptible, and resistant to the different drugs. The bacterium is said to be susceptible to an antibiotic or antimicrobial agent drugs when the bacterium is inhibited by the concentration of the drug usually achieved in the blood following administration of the drug at the recommended dosage. A bacterium is said to exhibit intermediate susceptibility when it is susceptible to the drug administered higher than normal. So dosage, or when the drug has clinical efficacy at the body site when the drug has physically concentrated. A bacterium is said to be resistant to the drug when it is not inhibited by the drug administered even at higher than the normal dosages, or when specific resistant mechanisms are present in the bacterial isolate. In such an instant, the antibiotic should not be used for treatment. Coming to the mechanism of antimicrobial agents, antimicrobial agents are often categorized according to the principal mechanism of action. The mechanism include interference with cell wall synthesis, example are beta-lactam antibiotics, and then inhibition of protein synthesis, clindamycin, and interference with nucleic acid synthesis, example is rifampicin, and inhibition of metabolic pathway, that is trimethoprim sulfamethanazole. And next is antimicrobial agents resistance, how they are able to resist the drugs or the antibiotics. Bacteria may be resistant to one or more class of antimicrobial agents, or may acquire resistance by mutation or acquisition of resistant genes from other organisms. Acquired resistant genes may enable a bacterium to produce enzymes that destroy the antibacterial drugs, or express a flux system that prevents the drugs from reaching in its intracellular target site, and or they modify the drug target site, or they produce an alternate metabolic pathway that evades the action of the drug.